Leading businesses in the community, represented obviously by their executive staff. We were going to have dual speakers today. Bruce Hagan, the current president of the hospital, unfortunately is taken ill and isn't able to join us this morning. And I'm disappointed because I know he has a wonderful message as he's wrapping up his career at Dublin Methodist and moving on to be the new president of Marion General. But I am pleased that we have with us the new president of Dublin Methodist. That I think the coronation day is January 12th, but as Stephen said, I've been running this place as Bruce is going to take some vacation time. But the new president of our Dublin Methodist Hospital, Steve Bunyard. Steve is a Bowling Green graduate, MBA from Bowling Green, Deloitte, worked at Cincinnati's Children's. He's been at Ohio State in their hospital system, and has been with Ohio Health for a number of years. Presently is the COO of Dublin Methodist, and will be taking over the presidency here very shortly. We're very excited to have him speaking to us today. One of the things that I think that we have with the success of the hospital, and we hear this from the patients, we hear it from the families of the patients, is the incredible experience that takes place at the hospital. It's quiet, there isn't any paper, there aren't any loudspeakers, and the hospital system and their efforts have focused very hard on bringing that natural environment. And that doesn't happen just through the building system. It happens because there's lots of businesses in the community and individuals in the community that have donated their time and talent and dollars to do the extra things that make that hospital successful. And I know that a number of you in the room have been part of that, and if there's any of you in the room in the future that would have that interest, we have a development board. Bonnie Mailer is on the development board with myself. I was hoping that Bonnie might be here this morning, but we work in conjunction with Katie Trombitis and her team and Cindy Shepard at the corporate level, and would love to have your participation to help the hospital grow. There's some exciting things happening, and with that, I'm going to turn it over to Steve and let him share those with us. Steve?
So somebody was asking me the other day about whether I was going to I was going to watch the big bowl game. The big bowl game is actually Bowling Green against South Alabama. Didn't even know that. I had to look it up actually. So if you go to Bowling Green, you don't follow football all that much, honestly. So I'm delighted to be here. As Paige said, I've been around a little bit. I want to just back up for a moment and talk about Bruce. Many of you in the room do know Bruce Hagan. Unfortunately, he couldn't make it here this morning. Bruce and I have worked together for many years. He came here, of course, to Riverside, and then moved from Riverside over here to Dublin, and now is moving up to Marion General. And as part of his legacy, he has been working with succession planning, leadership development, those types of things. So Steve Markovich, who was his chief operating officer over at Riverside, is now the chief operating officer basically for the Ohio Health System. So Steve will be my boss. So Steve moved from the chief operating officer to the president of Riverside when Bruce came over here. Bruce is now moving to Marion, which is giving us an opportunity to do some further succession planning. So it's great to continue to be here. I've been at the Dublin Methodist Hospital for about 2.5 years as the chief operating officer. Before that, I was the chief operating officer at the Employed Physician Group, which is called the Ohio Health Physician Group, and before that was actually at Doctors Hospital in an operations role. So I've been at Ohio Health about 11 years. And I'm thrilled to be able to stay in the community here. Just a couple of comments about the organization, Ohio Health, and then we'll talk just briefly about what's going on in Dublin. Ohio Health, you may know, just recently entered into a certification process with MD Anderson, and that's a really big deal for us in this community. You'll see a lot of activity on that. Riverside and Grant are now certified. There's over 100 physicians that are being certified through the MD Anderson Network. Dublin and Grady are in the process of certification right now, so we'll be certifying in probably about the next 6 months. You may also have read over the last year or so that we continue to grow. So our most recent additions in Ohio Health are Med Central up in Mansfield. I grew up in Galion too, so that's kind of my own hometown up north. So Med Central and Mansfield, along with O'Bleness down in Athens, are our two newest hospital partners in the system. So we continue to grow regionally as we think about what we need to do to be able to take care patients in the future. You've probably also seen the roughly $250 million little addition going on in Riverside. If you drive the S-curve there, that's a neurovascular tower, and also is giving the ability for Riverside to basically move to entirely private rooms, which they've not been able to do up to this point, which is a big deal. So let me move over to Dublin a little bit. Lots has been going on here, and I want to just thank you all as members of the community, as business leaders, as folks in the community. We have enjoyed remarkable support from all of you as Dublin Methodist has continued to grow. So just a couple of highlights that are happening over there for us. So when we first started, as an example, we had 4 operating rooms. Last week, earlier this week on Monday, we brought our 8th OR online. So in 6 short years, we have effectively doubled the operating room capacity based on demand and physicians who have wanted to come and practice in this community. We are running now the 2nd busiest robotic program in Ohio Health at Dublin Methodist in urologic as well as GYN robotics. We have 2 now Da Vinci robots over there, which is a really big deal for a fairly small hospital. We have a premier robotic surgeon, urologic robotic surgeon by the name of Ronnie Abaza, who joined us about a year and a half ago from Ohio State and has taken that program to a great level. So we're very proud of the work that's been going on in our operating rooms. We continue to deliver a lot of babies. We'll do over 2,000 babies at Dublin Methodist this year. So it seems to be becoming a destination for folks that want to deliver. And just from a scaling standpoint, that's roughly a third of what Riverside does. So Riverside does about 6,000. We're doing nearly 2,000, which is pretty big for a fairly small hospital. We continue to grow on the inpatient side as well. We are effectively out of inpatient beds because of the demand. Thankfully, our predecessors, those of you that remember Cheryl Herbert, built us with a little bit of capacity in the building, so we've continued to grow within the footprint that we have. Sometime over probably the next year, we will bring what we have, one final shell unit available for about 20 beds up on our 4th floor. We will bring that online, and then we'll be out of space effectively within Dublin Methodist. That then means that we have to start thinking about what do we do from here. So some of you may be aware the footprint of the site at Dublin Methodist is large enough for roughly a 300-bed hospital. So when it was built with the idea that it would need to grow at some point, and we're just beginning now to think about what does that next growth look like on the site. So it is a really exciting time at Dublin in terms of the growth, and we've continued to expand our service offerings there. The one thing that I do want to let you all know about, which is a really big deal, we've been really proud, as Paige said, we love the quiet in the place. And, it's a delightful building. It's wonderful to come into. We don't ever hope anybody gets sick, but if they do, we love having them there, and we want to take care of them as best as we can. But that isn't where it ends. We also spend a lot of time on safety, on quality, on the types of things that really do matter to us at the core. And there is an organization called Leapfrog, which is kind of a consumer watchdog group effectively that rates hospitals across the country. And it's on objective metrics of quality, of safety, of patient experience, infection rates, readmission rates. There's a number of items. We have been at Ohio Health, what's called an A-rated Leapfrog hospitals. All of our hospitals in Central Ohio have been A-rated for quite a number of years. But I'm also delighted to tell you that in this just past cycle of Leapfrog, they identify what they call their top hospitals, where the hospitals that are A-rated, they take them to another level of rating. There were 3 hospitals in the state of Ohio that received that top hospital rating from Leapfrog, and 2 of those were Dublin Methodist and Grady Memorial Hospital. So we have a lot to be proud of in this community. Our physicians, our nurses, the folks that are providing the care at Dublin in a quiet, beautiful setting are also doing a really wonderful job at taking care of patients, and that really is the core of what we do. Just kind of a final comment, I just want to make sure you're aware that we also run our leadership team. We're a prototype leadership team, I think, for Ohio Health. We actually, our leadership team runs both Dublin Methodist and Grady Memorial Hospitals. So I go back and forth, as does our leadership team, basically from a director level on up. And part of that is for us to determine whether we can, in smaller hospitals like this, what can we learn from one another, what can we take back and forth. And it's proven to be a really good project for us. We've been doing it about 1.5 years now. And we're beginning to see a lot of the fruits of that. A lot of that comes out in things like leapfrog recognition. So I'm going to stop there and see if anybody has any questions or would like to